Hello everybody, how's it going? Today I'm here to discuss essays, 8 markers and 16 markers for AQA psychology, and I'm going to have a focus on paper 1 topics. I'm going to look at an example of an essay on authority and personality, one on the biological approach to treating OCD, and one on Romanian orphan research and the effects of institutionalization. And it's just about how I tackle them. I'm going to talk through, I suppose you could call it a model example, and kind of break down how I plan it and how I structure it. Okay, so hopefully that'll be helpful for you. But let's crack on. Right, here's one example from Social Influence. Discuss the authoritarian personality as an explanation for obedience for 8 marks. So what am I going to be thinking about here? So before I start writing anything, I'm going to take a second to break down the question. We've got knowledge, and we've got evaluation or discussion as the key skills to show here. In terms of a mark breakdown, this is probably going to be a 3+5, but it could be a 4+4. You're not going to know on the day, so don't worry about it. I know a lot of people, like to try and work out exactly how many marks you're not going to know, okay, for an 8 marker. Just remember that the key thing is you're showing knowledge, you're showing evaluation or discussion, and it's going to be full of terminology, it's going to be effective, it's going to be high quality, yeah? So, there you go, terminology. So, what we're going to do here is we're going to talk about the theory itself, so the authoritarian personality, but it's not just describing what that means, it's trying to talk about how it explains obedience, yeah? So you make sure you're going to link to obedience in that description. And for an 8 marker, I'd be having 2 evaluation or discussion paragraphs, okay? There isn't really a set number that you need to do. There is a bit of a depth versus breadth trade-off, but what I wouldn't do is have, especially for an 8 mark, I wouldn't be having 4 or 5 kind of brief points that's just one strength is, and then a new paragraph, one strength is, because it isn't effective. So you need, a bit of a balance. I think one elaborated kind of discussed point isn't really enough, so that's what I'm suggesting too. But I wouldn't do more than that because you won't have time and you won't get that depth. Okay, so in terms of content, a bit of a plan before we start. I'm going to talk about the personality traits. I'm going to make sure I kind of try and link them to obedience, or at least mention obedience. I might talk about that it comes from upbringing, and I might talk about the fact that it's measured on the F scale. We'll see how that goes time-wise. For 8 marks, that's 10 minutes of exam time. It's about a page of A4, depending on the size of your writing. So I'm going to start writing that knowledge, and after about 3 or 4 minutes, I'm going to reflect on, okay, well, I need to be pretty much done with that because I need to be moving on to this evaluation. I know that's quite tricky, but that's what you kind of have to do. Right, in terms of evaluating it, this is a theory we're evaluating. So this is how I like to think about evaluating theories. This is just a screen grab from one of my Skills for Psychology videos. I like to think about, is it a scientific theory or is it based on, scientific method? Is there research support for it? Is it too reductionist? Does it have explanatory power? Does it actually explain why, in this example, why someone would obey? Has it got real world applications? And what are the ethics or kind of like free will determinism kind of debate around it? Those aren't the only things that you can use to evaluate, of course. It's just some of the things that I like to think about. Okay, so in this case, research support, but it is correlational, that research. So maybe we could talk about scientific method. It doesn't really fully explain obedience because there are situational factors as well. So that was our plan. Now we're going to talk through actually what it looks like written up. So I'm starting off with the knowledge here. The authoritarian personality refers to a collection of dispositional traits that are associated with being obedient. These include rigid, black and white thinking, conventionalism, being submissive to those above, so obeying and respecting authority, yet aggressive or dismissive to those below themselves in the social hierarchy. It's believed that these traits stem from a strict upbringing, where respect and tradition was enforced. Now obviously that's not the only way of wording that, but look at how I've written that in terms of that terminology. I've linked to obedience, I've talked about some of those specific traits, yeah? Okay. One of the evaluation paragraphs. So, one strength of the authoritarian personality is that it's supported by research. For example, Milgram invited participants in his shock study for a follow-up, where he gave them personality questionnaires. He found a positive correlation between score on the F scale, a measure of authoritarian personality, and voltage delivered in the original study. This suggests a strong link between these personality traits and obedience, supporting the authoritarian personality explanation. Now you could stop there, But what I like to try and do, and you'll see this throughout the video, is introduce a counter-argument to develop this discussion, and then bring it back together at the end. So I'm going to carry on. Despite this, such evidence is only correlational and is self-reported. Due to these methodological flaws, it could be argued that there is at best partial support for the role of authoritarian personality in obedience. Okay, now personally I'm not sure that's quite enough, and that's probably only taken me about 6 or 7 minutes so far, so I'm going to introduce another point to give the examiner the feeling that I've got a bit more breadth to this. Okay. So a further issue with the authoritarian personality is that it only considers dispositional factors. Yes, it's only personality. Despite some research support, other work such as Milgram's variation studies demonstrates that situational factors, such as proximity and location, have a significant impact on obedience. This demonstrates that obedience cannot be solely due to disposition. Therefore, the authoritarian personality is at best a partial explanation for obedience. Okay? I quite like the word partial in this essay, don't I? But you get the idea. So what have we done there? Yeah, terminology in that first paragraph. And then the evaluation starts with a clear signpost. We're talking about some research evidence here. Now, it's not a key study. This is the Elms and Milgram study that you might be aware of, depending on which textbook you use. But that's not a key study. But I'm showing understanding of research that does exist. I'm explaining why that research is important for the theory I'm evaluating. And I'm bringing it back together with a conclusion at the end that links back to the question, yeah? Is the theory a good explanation of obedience? Okay? And the same with that second evaluation paragraph as well. Clear signposting at the start. What does it mean, yeah? Lots of sentence starters like this matters because, this demonstrates, this shows that, therefore, things like that, okay? There you go, and a conclusion at the end as well. Don't need a separate kind of conclusion to the essay at the end. I think we call them essays in psychology because they're kind of extended writing, but it's not really an essay in the traditional sense of the word. Yeah, when you think of essays, you normally think about writing an introduction and then a conclusion and having an overall line of argument all the way through. And I think some of those things are helpful to consider, but really, it's just a piece of extended writing, and you are just showing knowledge and evaluation skills. You don't need so much in the time pressure in the exam here at A level. You don't need to be doing introductions and conclusions. They don't really add much in this context. Beyond A level, sure. Or if you're writing an essay, for another purpose, definitely. But for the purpose of this, I wouldn't be bothering with introductions and conclusions. Okay, so here's another one from paper 1. This is a psychopathology essay. So it's outline and evaluate the biological approach to treating OCD for 16 marks this time. We need knowledge and evaluation. 6 knowledge marks, 10 evaluation marks. Now we do know that for a 16 marker, that's just outline and evaluate, or discuss. It'll be 6 plus 10. 16 marks is 20 minutes of exam time. Now in reality, when you're actually there on the day, you might have banked a couple of minutes elsewhere on some of the shorter questions, or maybe some research methods, or some multiple choice. So you might, have up to maybe 25 minutes to tackle one of these, but you should be writing, getting on for 2 sides of A4 really. If you've got big writing, it should probably be a bit more than that. Okay. Terminology. For this, I'm going to talk about 2 or more drugs, I reckon, for 6 marks. Not sure I could get 6 marks just talking about SSRIs, but we'll see. Including kind of how they work. And then I'm going to, in a 16 marker, include 3 or 4 evaluation paragraphs. Okay, so this time we are evaluating a treatment, and these are the kind of things that I like to think about when I'm evaluating a treatment. So the effectiveness and the appropriateness of that therapy, and that is actually what AQA do mention on the spec, those 2 things. But I also, to supplement that or to link into that, I like to think about how accessible these things are. So, can a wide variety of people actually do them? And I like to think about the economic impact, so short-term cost, long-term cost, all of that. And also, are they ethical in terms of maybe side effects or how they treat people? And these things, as I said, kind of link into the effectiveness and the appropriateness, but they're just other themes that I like to consider to help me to discuss. In terms of content, I'm going to talk about SSRIs and benzodiazepines. So that is the antidepressants and the anxiolytics, or the anti-anxiety drugs, sedatives. I might mention side effects in the knowledge. I might, depending on how it goes, how I feel when I'm writing it, I might actually bring the side effects into the evaluation, or both. In terms of discussion and evaluation, I'm going to consider how effective they are, how appropriate they are, And maybe, again, that economic issue, maybe they are cheap, but maybe in the long term, because people have to be taking them, maybe I'm going to make that into a discussion point. I might even there, mention an alternative. I might say about how CBT might save money in the long run. Okay, so that's my plan. So let's do it. Right, so I'm going to start off with a bit of knowledge on one of the therapies. I've chosen SSRIs here, selective serotonin reuptake inhibitors. So let's go through. Well, one biological therapy for OCD is the use of selective serotonin reuptake inhibitors, SSRIs. These drugs block the recycling of serotonin back up into the presynaptic neuron. This means that the neurotransmitter remains in the synapse, thus increasing levels of available serotonin. This restores normal functioning of the worry circuit. Yeah, remember the worry circuit? Orbitofrontal cortex, caudate nucleus, thalamus. Anyway, thus relieving anxiety and obsessions. Common side effects include insomnia and headache. I wouldn't have to put the side effects there, but I thought I'll just throw it in. It'll only take a sec. Is that 6 marks of knowledge? No, it's not, is it? So here we go. Another drug therapy for OCD is sedative drugs called benzodiazepines. These drugs alter the function of GABA receptors on the postsynaptic neuron by increasing the efficiency of chloride channels, meaning that GABA activity is improved. Because GABA has an inhibitory effect, benzodiazepines slow down neurotransmission and calm the nervous system, thus reducing stress and anxiety. Common side effects include tremors and nausea, and they can be addictive, so are often used for a short period. Again, that last sentence, maybe, maybe not, but I've thrown it in there because I've remembered it on the day, and it's only taken 10 seconds or whatever to put in there. Right, evaluation. One strength of SSRIs for OCD is supporting evidence. Yeah, nice clear starting point. Signposting to the examiner, here's my evaluation, start crediting evaluation please. A review found that SSRIs were more effective than placebo. Since such trials are controlled with a placebo, drug therapy is an effective and evidence-based approach to managing OCD. However, here's another counterpoint there. I do like them. However, one issue is that most follow-ups are only a few months. This means that little is known about the long-term effectiveness of drugs. Furthermore, the issue of publication bias means that it is unlikely that we have a clear picture of the true effectiveness of drug therapy for OCD. On balance, one of my favourite phrases, on balance, perhaps drugs are an effective short-term solution for OCD, but it is difficult to be certain. So we're sitting on the fence a bit there, but sometimes that's okay. A further strength of drug therapy is that it requires minimal effort. In comparison with cognitive therapies, which require motivation and commitment, drugs are much easier to engage with. So we don't have to compare in this essay because it's just evaluate, but I think this is quite a helpful discussion point. Anyway, this means that patients may be more likely to take them. Therefore, drug therapies are seen as an accessible option for OCD. However, the side effects associated with drug therapy mean that they are not acceptable to all, and some people actually stop taking them or need other drugs to counter side effects. So we need to bring this together now and answer the question again. On balance, whilst drug therapy is a viable option, it may not be the most appropriate solution for treating OCD. Now, some of you may, and I understand, kind of run out of time at that point, and that's fine, but really to be pushing for top marks here, 4 marks, I would expect a little bit more in terms of that 10 marks of evaluation. So I'm going to add another paragraph here. Finally, another strength of drug therapies for OCD is their economic advantage. They're cheap to prescribe and do not require weekly interaction with professionals. Therefore, they are a cheap option for the NHS. Despite this, critics point out that since drugs do not cure OCD, it's likely they'll be needed for many years. It's therefore possible that alternatives such as CBT, which gives the patient coping strategies, may turn out to be a cheaper option in the long run. Let's bring it back together. On balance, drug therapies are a cheaper short-term option, but the long-term drain on the NHS is not ideal. And there you have it. So what have we done? We've shown clear knowledge with good terminology of 2 drug therapies, and we've got 3 evaluation paragraphs that include development, examples, counter-arguments, conclusions. Yeah, they begin with clear signposting to the examiner that this is evaluation, and they've brought it back at the end of each paragraph with a focus back on the question. So is drug therapy actually a good treatment for OCD? Okay, now that's about, I don't know, it might be 500 words. I'm not going to count them all, but that's only taken me a few minutes to talk through. I know obviously it'd take a lot longer to write, but if you practice and you have the content, at your fingertips. You're confident with the knowledge and you remember the evaluation points. That is more than achievable in the exam time. Yeah, I know it's tough, but it just takes practice. So there you go, that's that one. Right, let's look at one more. Alan, 6, and Alex, 1, are Romanian children who've just been adopted by a British couple. From birth, they lived in an orphanage with lots of other children in poor conditions. Outline and evaluate research into the effects of institutionalisation. Refer to the possible effects on Alan and Alex. 16 marks. Okay. So, again, another paper 1-1. This one from attachment. And we need to break it down. We need to think about the command words. Outline and evaluate. Okay, so I'm showing knowledge and I'm showing evaluation. Refer to the effects on these children. Okay, so there's also application here. So what does that mean? Well, 16 markers. Again, remember it's 20 minutes of exam time here for 16 marks. But 16 markers that have a scenario are 6 plus 4 plus 6. Now again, that doesn't really matter, but it is important to think about the balance of those skills. Yeah. So you do need a fair bit of application there, and remember that some of that evaluation isn't necessary in terms of how much to include, how many paragraphs to include. If you look at the balance of those marks, in a typical essay, like the one that we looked at a minute ago, the bulk of our response was evaluation and discussion. Actually, that's reversed here, isn't it? You've actually got 10 marks of knowledge and application. So that needs to be the bulk of your response. That might be a page long, knowledge and application. Yeah, and then half a page or so of evaluation. So even though it doesn't really matter when you're writing it in terms of have I got 6 marks of that, have I got 4 marks of that, yeah? Thinking about the balance and how much time and space to spend on these things is important. So I would suggest for those 6 evaluation marks that 2 evaluation paragraphs is fine. Okay, in terms of content, research into the effects of institutionalisation. Okay, research, institutionalisation. What should come to mind here, I mean it even says Romanian children in the STEM, is the orphan research such as Rutter's ERA study, yeah, Rutter and Sonuga Bark. You don't have to use that one, it's not a key study, but Romanian orphan research is named on the spec, so you must know a study. And feel free to bring in more than one study, but you need to know the details of a study. It's just that you don't have to know like specific numbers in the sample or anything like that. Okay, so I'm going to cover the procedure and findings of that, focusing on, in terms of the findings, those effects of institutionalisation, because that's specifically what the question is about. And then I'm going to apply those effects, and I might probably do that in a separate paragraph. I feel like if I try and do all 10 marks of knowledge and application in one, it might get a bit long and confusing. So I might separate that into a separate paragraph after I've done the knowledge. And what I can see from the STEM is that these kids are, quite different in terms of age, and I know from the Romanian orphan research that the younger ones, when they were adopted younger, they tended to catch up. So I might talk about how actually, these effects are likely to happen, but maybe the younger one will catch up. So that might be some good application there. And then I need to do some evaluation. Now I think, with these orphan follow-up studies, particularly the Rutter one, they've done it for many, many years. So that's good, it's longitudinal. But remember, it's a natural experiment, so I could talk about the lack of that control and manipulation of an IV. So that might be one discussion. And I could then have a separate discussion about how generalisable these findings are. Now remember that the Romanian orphans were in that situation because of a complex set of, I don't know, is geopolitical the right word, socio-cultural, whatever you want to call it, those kind of circumstances that were going on. Yeah, you got the fall of the Romanian, is it Ceausescu? I don't know how to say it, but the dictatorship that was happening, in the late 80s, and all of that going on. So are the effects just because they were in an orphanage, or is it more than that? Yeah, so maybe that even kind of confounds some of what we know about the effects of institutionalisation. Anyway, that's what's in my mind when I'm reading that question and thinking about what kind of things could I talk about. Okay, so I haven't actually got space to put the question on this one because of that STEM, so I'm just going to go straight through it. Okay, so I need to do knowledge first. So I'm going to start off. The ERA study was a longitudinal natural experiment conducted by Rutter et al. That followed up Romanian orphans who'd been adopted into the UK. Now, I know that it was also done by Sonuga Bark, but I'm trying to make the point that you don't have to know all of the specific details because it's not a key study. Yeah. So I'm just going to say Rutter et al. Because let's imagine on the day I could only remember Rutter's name. Fine, don't worry. Okay, these orphans had lived in poor conditions and had been unable to form attachments. The researchers assessed the children at regular intervals throughout their development, measuring physical growth, cognitive development, and socio-emotional development. Okay, so I don't have to know exactly what ages they were tested at. If you know that, brilliant, include that. That'll impress the examiner. But it's not a key study. These children were compared to a control group of British adopted children in order to assess the effects of institutionalisation. Yeah, so that's the procedure. It was found that the Romanian orphans lagged behind the control group on all measures. They were physically smaller, scored lower in IQ tests, and teachers and adoptive families reported friendship and social difficulties, including, and here comes the terminology, disinhibited attachment, which is being over-friendly to strangers, attention-seeking, and not managing boundaries properly, and quasi-autism, which is about impaired language and communication, and reduced empathy. Later follow-ups showed that these effects continued for most orphans, but those adopted by the age of 6 months began to catch up to their British peers. Okay, there's quite a lot going on there. I'm happy with that as a knowledge paragraph. I've covered research, I've covered the procedure and the findings, with a focus on the effects of institutionalisation. So I need to do some application now. Alan and Alex are Romanian orphans, and so are both likely to experience the effects of institutionalisation. So I'm introducing why I can apply my knowledge to these children, yeah? Okay, so what are the effects? They may struggle, and here, by the way, I'm not just repeating the knowledge. What I'm actually doing is, in context, in terms of like a real-world impact, what might happen to them, yeah? That's me applying my knowledge. So, they may struggle with their learning. Due to delayed cognitive development, they're likely to score lower in class tests or not understand lesson content. They're both likely to be physically smaller than peers. They may struggle in sports. Due to quasi-autism and disinhibited attachment, both children are likely to experience difficulties in forming and maintaining relationships. Oh, there's a typo there. Oh well, sorry. They may not cope with the authority of teachers, and they may struggle to relate to or communicate with other children, perhaps becoming aggressive when having to share. Yeah, so again, I'm kind of explaining what we might actually see in terms of the impact. Okay, an important application point here, and this is why I made sure I mentioned it in the knowledge so I can use it here in the application. Despite this, Alex was much younger when adopted, so it's possible he will catch up to the others at school and not experience such severe effects. Okay, I'm happy with that. It looks a little bit less because remember that there's 4 application marks compared to 6 knowledge marks. Yeah, but that's fine. I've done loads of application there, so I need some evaluation. One strength of research, such as Rutter's ERA study, is its longitudinal design. By following up the orphans over time, we've been able to discover the long-term effects of institutionalisation, as well as the fact that those adopted younger may be able to catch up. This has had significant real-world application to the care system. For example, we now understand the importance of early adoption in supporting children's long-term chances. Despite this, it must be noted that this is a natural experiment. Rutter et al. Were unable to manipulate the IV and randomly assign whether children were institutionalised. So I've mentioned that there about, assigning them to being institutionalised or not, so that this point doesn't become generic. This means we're potentially unable to draw causal conclusions, again here's the not generic bit, about the effects of institutionalisation, undermining the validity of such research and our understanding of the effects. Yeah? So you can use discussion points that are based on kind of, research methods or even issues and debates in your essays, but whatever you do, don't let it come off as something generic that could kind of copy and paste into any essay. Yeah, make sure you're linking it to the question or to whatever it is that you're evaluating. Okay, one more I think, to get those 6 evaluation marks, to have enough breadth there. A further limitation of research into institutionalisation is that it is largely based on a unique set of children. Orphans were adopted against a backdrop of widespread poverty and the downfall of the Romanian dictatorship in the late 1980s and early 1990s. Now that's a bit of knowledge that I've kind of remembered on the day, and I understand the context there. You don't have to know that, but I think it's helpful in this argument, isn't it? Arguably, this unique set of socio-cultural circumstances means that Romanian orphans did not only experience the effects of institutionalisation. This undermines our ability to draw universal conclusions from Romanian orphan research, as the findings may not generalise to children elsewhere. Therefore, the effects of spending the early years of life in an orphanage may have been overstated by research. Now, I'm not trying to downplay, the issues that might come out of an early experience like that. I'm just saying that the effects that we've seen on the remaining orphans aren't necessarily going to be the same as any other child elsewhere that has spent time in an orphanage. Yeah, so maybe if we just focus on the remaining orphan research, we're seeing kind of the most severe side of it, if that makes any sense. Okay, so what have we done? We have got a knowledge paragraph. We needed to do that because the command word outline was there. We've applied our knowledge, yeah, to get those 4 application marks. And we've got 2 evaluation paragraphs that are signposted. We've got a counter argument in that first one there, and we've brought it back together at the end. The next one is signposted, and again, concluded, yeah. Okay, right, that was me discussing how I tackle essays for AQA psychology with a focus on paper 1. I hope that was useful for you. Let me know how you're getting on in the comments. Ask me a question if you like, I'll try and get back to you. All right, keep going. You can do it, it just takes practice. Bish bash bosh.